We have Ruqaiyah here today for our series for ADHD Awareness Month. Thank you for joining us.
Thank you for having me.
And this is perfect because yesterday on our lives we talked about the differences between therapy and coaching, and
Yes.
today we're going to be specifically talking about the different therapeutic practices that could be really helpful for the ADHDers that are listening today.
Yes.
Um,
Yes.
do you mind introducing yourself?
Not a problem at all. My name's Ruqaiyah Rogers. I'm a licensed clinical social worker here in Michigan, and I've been practicing as a therapist, psychotherapist, many different titles that we go by since 2012. So, in and out of outpatient clinics, agencies, and in community settings too, being a therapist, counselor, and all things good, trying to bring healing to the world.
I appreciate that. We need more people. I've actually thought about, I still have an MSW as well, and I've thought about getting a license that I probably should have gotten 20 years ago, but
Yeah.
better late than never. So we are thankful for you to hear. I think therapy is always like a hot topic for the ADHDers, or really just for anybody just talking about therapy and
Yeah.
understanding like what are some of the different types of therapy that people can experience, and just to kind of hear your thoughts about
Hmm.
what actually could be helpful for ADHDers and maybe why.
Yeah.
And then, specifically, we put on the advertising, specifically CBT and DBT,
Yeah.
but can you talk to us about the differences between the two?
Yeah. Yeah. Well, I would say since 2022, I launched my full-time private practice, Purple Pen Therapy, and consulting services. And in terms of my niche or niche, however you decide to say it,
Yeah.
I really tried to focus in on ADHD and trauma, as well as anxiety. And when it comes to using different approaches or modalities for treatment of specifically ADHD, CBT and DBT are two of the ones that have been more promoted in terms of being able to be that solution
Mm-hmm.
focused, solution oriented, and being able to produce change because you're looking at the brain, of course, it being a neurodevelopmental condition with ADHD, and being able to bring out practical solutions and changes in our everyday lives.
Mm-hmm.
I myself have ADHD and just discovered that only 2 years ago when I
Oh,
had
wow.
my two children evaluated. So kind of the aha moment and the deep dive down the rabbit hole as far as ADHD and kind of being transparent. I had started getting back into therapy myself for
Mm-hmm.
some of my own daily challenges with anxiety, feeling really overwhelmed. And that definitely came with becoming a full-time small business owner and entrepreneur and
Yes.
understanding, thinking that I'm struggling with anxiety. And lo and behold, what I really was struggling with was kind of the offshoot or the uh, bigger part of having ADHD.
Mm-hmm.
And so understanding that cognitive behavioral therapy and dialectical behavioral therapy can be really, really helpful. And on one hand, cognitive behavioral therapy is going to deal with those things in terms of behaviors, thinking patterns, and decisions.
Mm-hmm.
And dialectical behavioral therapy is going to deal with that emotional regulation
Mm-hmm.
and that impulsivity and some of those things in terms of restlessness that you can struggle with trying to deal with kind of your day-to-day uh, interacting with people,
Yeah.
being able to kind of better understand how to uh, better situate and navigate through life when you have ADHD. So that's kind of an overview of that.
Yeah. Thank you. Thank you for sharing your story as well. It definitely ties into what Dr. Sean and I talked about yesterday in terms of
Yeah,
therapy and the experiences that ADHDers have, especially with women getting diagnosed older. And a lot of the times it's because it shows up inattentive. We were just not on the radar in general for a lot of people that were studying ADHD, especially in
hmm
the 70s, 80s, and 90s. Like that was not
yeah,
even a thing. And
Yes.
and then what's happening, our kids are getting older, and then our kids are getting diagnosed, and then we realize that our kids are just like us.
Yes. Where did that come from? Couldn't have been me. Yes, it is.
Right, right. Um, exactly. And so I think it's important to acknowledge the importance of accessing therapy when you have ADHD.
Mm-hmm.
Um, and what we talked about over the past couple of weeks too is that it's important to have multiple touches when it comes to different interventions
Yes.
and not just one. But we wanted to make sure that we specifically talked about how therapy in of itself can be really helpful. And
Yes.
again, for those that are joining, we're talking about CBT and DBT and cognitive behavioral therapy and dialectical behavior therapy.
Yeah.
Um, and just to reiterate what she said, just to repeat it.
Yeah. Yeah.
For those that are listening and just tuning into, CBT focuses on like identifying and changing the negative thought patterns and behaviors, and then DBT focuses on developing mindfulness and emotional regulation skills,
Yeah.
um, and both of which
Mm-hmm.
are extremely helpful
Yeah.
for the ADHDers,
Yeah.
for multiple different reasons.
Yeah. I think, understanding that with CBT, with working on those patterns of negative thoughts, behaviors, and beliefs too.
Mm-hmm.
And I think the beliefs can oftentimes feed into the emotions. And for CBT, we often look at, what are some goals in terms of, because people will call and reach out for help for ADHD and anxiety
Mm-hmm.
or ADHD and depression. And they'll have very specific goals in mind
Mm-hmm.
because if they are struggling more with the procrastination and they trying to improve the focus and attention, then CBT can help with trying to challenge some of those negative beliefs and trying to reframe the negative thinking.
Mm-hmm.
And so instead of someone saying, I can never get anything done, we can work on challenging that. Well, is that really true?
Right.
And being able to point to, well, what are some things that you have been able to get done in, the last 2 weeks? Because we also will check in on
Right.
where their symptoms are with anxiety and depression, and understanding that once we look at a smaller time frame, that people will recognize, well,
Mm-hmm.
maybe that isn't true, but I want to be able to do more. Well, let's see if we can look at breaking that down into manageable pieces so that you can get more done, but over a longer period of time, especially
Yeah,
if
and
someone struggling
exactly.
with the timelines. Yeah, yeah,
Yeah, I love that. And just thinking about, the key, I think one of the key statements that you just said is like really challenging
hmm
the negative thought that is coming that way, right? And we also struggle with black and white
yeah,
thinking too. So it's like, oh, I can never do this. I'm never going to be successful. Like, and
hmm
it's that language that really
correct.
needs to be challenged
hmm
because then, if you keep saying it, you're going to truly believe it. And so how can you shift the way that you're talking about your own ability to be successful, your own ability to be able to get things done,
Yeah.
and really challenge some of the definitions that we're using when we are speaking about anything in our life, right?
Yes. Yeah. Yeah, a lot of
Mm-hmm.
times, you know, the way we are brought up in our households, and especially with ADHD, like you say, there's been a lot of stigma.
Mm-hmm.
The 70s, the 80s, the 90s. Even now, today is World Mental Health Day, and we are talking about how people have such a hard time being neurodivergent in the workplace, and
Mm-hmm.
and all the challenges and struggles that come with just not feeling like you can be squoze or fitting, making somebody fit in a round hole when they're square or whatever
Mm-hmm.
shape or size or dimension that you see yourself as. So really being able to understand that cognitive restructuring really is going to take that person in a whole different direction, as well as give them that behavioral activation, because so many times when I work with the other thing that is really interesting too, working with people in different professions, one of the bigger challenges that people do struggle with is working from home, and
Yeah.
changing up a lot of different habits and things that come out and become exacerbated because the tight structure in those four walls of a corporate setting um, end up creating a lot of turmoil and a lot of emotional distress for people, and really being able to work on those time management and organizational skills through using cognitive behavioral therapy.
Yeah, because when you're at work or you're at the office, you are just at the office and just at work. But you're at home, you're now dealing with all of the things that happen in your home. Like, and also, if you're struggling with keeping your house organized, and that's a little plug for us coming to tomorrow's conversation, because tomorrow we're going to have a professional organizer come in to also talk about ADHD and organization. And so if you are, if you're struggling with keeping your space organized and now you're working from home and now that's causing a distraction,
Hmm.
and now you're now spiraling and now you're having these additional negative thoughts. And so, like, being able to access different types of therapy and mind and thought shifting can be really
Yeah,
helpful
yeah,
in that
yeah.
space.
It can. I can. And I think that that's where then sometimes, within a session, okay, I'm going to use whatever is going to help the person
Mm-hmm.
in that moment. And of course, we're looking at CBT and DBT. But when some of that frustration builds and builds and builds, and it's almost like a teapot or, boiling water,
Mm-hmm.
and the person just completely starts to melt down and finds not only that fight, flight, or freeze response has been activated, then, you're dealing with kind of the emotional regulation piece and the distress tolerance piece, and also the interpersonal effectiveness skills, because dialectical behavioral therapy is going to help manage those emotions,
Mm-hmm.
manage those things that are going to also be a big part of ADHD and the impulsivity. Because if a person starts to feel very overwhelmed and then they want to get away from that, and maybe their stress response is to flee,
Mm-hmm.
they get up, they say, I'm going to take a break. And next thing you know, an hour has passed, 2 hours has passed, 3 hours has passed,
And you haven't gone back to it.
and you haven't gone back to it, and then your whole day is gone, and you go back, the next day or over the weekend, you go back and you're like, I didn't get anything done. Now what am I gonna do? And then that starts the ADHD spiral of shame.
Mm-hmm. And then you go back to the shifting of the thoughts, right? So it's
Yeah,
even when you start to get emotionally dysregulated and now you haven't got anything done that day. Well, you think that you haven't gotten
yeah,
anything done that day. So
yeah.
you told yourself, oh my God, I didn't get anything done that day.
Hmm.
And so then now you're battling between trying to regulate your emotions again, but then also that negative thought pattern.
Yeah,
Because again, is that really true? Like, you may have not on everything that you wanted to get done that day, but that doesn't necessarily mean that you didn't do anything.
yes, yes, yes. So I like to look at how can people start to really check the reality. And a lot of things about CBT is to be able to understand that there's an acceptance that has to
Mm-hmm.
happen before you can change the things that you don't like, or you want to change the things that you want to make better, and have a way to be able to track that. And,
Mm-hmm.
is it a planner? Is it using some type of electronic tracking system? Is it,
Mm-hmm.
trying to create a sense of accountability, um, doing some body body shadowing, um, something that's going to tether you to the task that it is that you want to get accomplished, and realistically be able to measure what is going to motivate me, because motivation can be intrinsic, internal, and it can be extrinsic, external.
Mm-hmm.
So sometimes with ADHD, even though the consequence is very clear, it's very black and white, speaking to the therapist in the audience, if you don't get your work done, you don't get paid.
Right.
Yeah, that still could be a really big hurdle for people to overcome, and understanding that I'm motivated by a different, set of standards. And therapy can also be the place to figure out that piece too.
That's so interesting. So there was a couple of things that you said there that I had some additional thoughts. So one was thinking about just the also the challenge that ADHD is having with working memory.
Yes,
And you had talked about like writing some of your accomplishments down and trying to make note of that. And so that is so important. And especially thinking about in the context of work or in the context of shifting from one job to the next. Like if you're
yeah,
thinking about how you're shifting from one job to the next, you have to write a resume, like update your resume, write a cover letter, and then you're interviewing. And then in that process, you're supposed to recall all of these positive things and all of these accomplishments
mm,
that you have done and experienced and worked on or whatever in over the past however decades of work, right? And so now you're in this new position. Now you need to prove yourself. You're trying to market yourself. You're trying to tell somebody else and explain to somebody else what your accomplishments are, right? But that can be really difficult if you haven't done some of
mhm,
that thought shifting work. And so like accessing some CBT methods, but then also in some practices of like writing things down, like what, when you're in a job, writing down the accomplishments and making sure that that is noted somewhere so that when you are starting to get through the negative thought patterns, you have access to that information to remind you of all of the accomplishments. And then you can also use that information for when you're interviewing and for and writing your resume
yeah,
or not writing your resume and hiring somebody else to write your resume
and
like I
that
do.
yeah,
And yeah,
yeah,
so it's all connected. So like understanding like how your negative thought patterns can really impact you professionally,
hmm,
um, and where you're trying to go professionally as
yes,
well. And
yes,
so doing some CBT exercises can really be helpful, and things that you can do on your own, and things that you can do with a therapist, and then you can practice with a coach also.
yeah, yeah. So it really, what's your cup of tea?
Hmm.
I'm so glad that when you do upload the therapy versus coaching, because I was seeing clients and didn't get a chance to see it. Um, I think it's really important to recognize that there are so many systems that also help in
Hmm.
terms of what's going to help you amplify, your talents and your skills and your strengths in the interview, as well as within, your working environment for your career. So really trying to figure out what systems. There are so many apps out there, more and more and more apps in terms of ADHD,
Hmm.
trying to figure out what's going to work for you. But the one thing that I always tell clients is that if it, and we as MSWs know this too. If you didn't write it down, it didn't happen. Or if you didn't write it down, your working memory may not pull back that exact fact.
Hmm.
So coming up with some type of system, whether it's Google Docs or there's many different beautiful planners out there, or
Hmm.
maybe you use a combination of electronic systems, working
Hmm.
systems, and diaries or journals or notebooks, whatever you know that you're going to go back to
Right.
and make it part of your regular routine and structure of your day,
Hmm.
really is going to have you on the feeling more accomplished and feeling better about yourself, and
Hmm.
really having a lot more self-compassion and gratitude, even when you do have the struggles and you do have those lapses of memory.
Hmm.
It doesn't have to be the end of the world, the catastrophic thinking.
Right. And and the reality is we're also living in a world that has that feeds a lot of negative
Yeah,
talk also,
it does.
especially for the ADHD.
Yeah,
And
yeah,
so like, between your family or your friends or other colleagues that don't really understand the ADHD brain and they're looking at you
hmm,
as though
hmm,
there's something wrong with you, and then you're internalizing that information. But it's good to be able to challenge
yeah,
those thoughts that you're hearing, because some of them are like you're hearing other people's thoughts about you,
yeah,
right? And so being able to challenge like whether or not there's truth or validity within what they're saying and also what you're saying to yourself.
yeah, yeah. That's really important, and with that emotional regulation piece, as well as the interpersonal effectiveness skills, being able to understand that what you want and need is important, as well as what other people want and need is important. But you have to learn how to ask for what it is you
Mm-hmm.
want. And with ADHD, at least I know for me, I always feel like I have to do everything myself. and
Mhm.
asking for help can be hard. But why within the ADHD brain you feel like you have to do everything yourself?
Mhm.
I think that comes from a lot of masking that we learn to do throughout our lives, not understanding that it's ADHD that you're, dealing with if you've been undiagnosed for all or most of your life, or if you've even been diagnosed, again, trying to battle those stereotypes and the stigma within trying to work within this neurotypical world instead of things being more on a neurodiverse spectrum.
Mhm.
So it's a lot of different strategies, life strategies really, that you start to look at that really help with the negative thinking and being able to really give yourself the uh, gift of understanding so that, whatever skills that you can learn in therapy and then be able to
Mhm.
practice them between the sessions so that it becomes more of a natural go-to, becomes more of your default instead of, we tap back into our fight, flight, or freeze or friend, people
Mhm.
pleasing when a stressor, you know, gets into our, immediate environment when we face a day-to-day stressor.
Right, and then you don't want to be in a position too where you're normalizing the stress.
No,
Um,
no, no, no.
Also, and so like a funny story,
Mhm.
quick funny story. So when I was in college, I definitely needed glasses, but I didn't even think about the fact that I could use glasses to help correct my vision.
Oh,
Instead,
okay.
I just moved closer. And I was like, oh, if I just move closer, then it's fine. Or if I just squint a little bit, it's fine. But like thinking, I wasn't even thinking about, of course, this is all before that I knew that I had ADHD. And so you
Yeah.
just keep, and the creative part of my ADHD brain is like, oh, I can figure out a solution by myself. Like I don't
Mhm.
necessarily need to go to a doctor and get and get my eyes checked.
Yeah.
And so it's you can get you can get stuck in that space where you think that you can solve all of your own problems, and so being able
Yeah.
to access some external support is a really helpful, because sometimes um, there's another perspective.
Yeah.
And
Yeah.
then there's other options that you can access supports. Like if you don't know how to do if you don't know any CBT exercises that you can do, reach out to a therapist. I mean, Google has a lot of information also. um,
Yeah.
but reach out to a therapist and ask specifically for CBT therapy. Like, ask them, like, are you familiar with the CBT approach, or are you familiar with the DBT approach? Like, do you use that in your practice in order to help support me? And so it's, conversations like this is also positioning you to be more informed. So when you are seeking therapy, you know what to ask for.
Yeah. Yeah. And definitely, like you're saying, understand what you're asking for and do your research, and knowing what questions to ask definitely can go a long way, because a great fit of a therapist, a good fit of a therapist is a big part of being successful with therapy, with meeting the goals for the things that you want to make better, change, or different in your life.
Hmm. Yeah.
Yeah.
And so I feel like we talked a lot about CBT.
Yeah.
Let's talk about, I always want to say diabolical. It's not diabolical, dialectical. I always forget what the D stands for. Um, behavioral therapy, and I'm not as necessarily familiar with the
Yeah.
technique in terms of like
Yeah.
what does it look like, or what are the questions that a therapist would ask you if you're doing a DBT session?
Yeah. So DBT, the Marsha Linehan is the oops, see, is the creator of dial. Now you're gonna have me say diabolical,
Sorry.
but it is, in a way, it is diabolical that you are able to access so much within our brains in terms of being able to regulate our emotions and
Hmm.
understanding that a lot of times we externally uh, 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 prioritize so many different things. And the thing about dialectical behavioral therapy, it is a form of CBT, cognitive behavioral therapy, but it really helps you to come back into the inner part of you, and to be able to come back into the moment with being mindful, to recognize in the present moment, to be able to change something that I'm struggling with. First, I
Hmm.
got to check in to understand what my emotions are saying.
Hmm.
What am I feeling? And once I understand what I'm feeling, then I can go ahead and check the reality of, is this really happening the way that I'm perceiving it?
Mhm.
Or is there something else going on that has activated me to make me feel really, really overwhelmed? And then I'm going into this negative spiral. So with dialectical behavioral therapy, I'm really going to work on trying to not only challenge your thinking, but have you to accept what you're thinking, accept
Mhm.
what you're feeling. And once you're able to do that, then you're able to regulate your emotions. Because a lot of times we'll get really hyped up and we'll start to believe that, oh, my supervisor told me that I was so just a terrible person, and
Mhm.
she didn't even try to understand. Well, what did your supervisor say? Well,
Mhm.
she said that I keep being late on my, I do really, really good work with my clients, but I keep, being late with my reports. Okay. Well, where in that did you hear that you're a really terrible person?
Mhm.
And so they're like, well, that's what I think. And
Mhm.
so because I think that, I feel that.
Mhm.
Okay. So tell me, so we start to look at what are some triggers
Mhm.
in terms of some of the things that become really, really difficult in trying to regulate your emotions. And from there, we try to work on some distress tolerance skills. So this distress tolerance skills are simply, I think the easiest way to explain it are those things that are going to bring us back down to base level, where we can then tap back into our prefrontal cortex, our thinking brain, where we do all the executive functioning things
Mhm.
about thinking, planning, executing, and then be able to recognize that, oh, I'm getting really worked up in the moment. And getting worked up in the moment is not going to help me. So, the biggest tenet also of dialectical behavioral therapy is that being able to access what we call wise mind. So we got three parts of our brain. We got the emotional part of our brain, which is
Mhm.
literally the right side of our brain, where that can be hot and cold. And then we have the left side of our brain, which is the analytical, the logical, the rational, the reasonable. But then we have kind of that middle path.
Mhm.
And in dialectical behavioral therapy, we really try to get people to understand. Let's try to get you to kind of that middle lane where you can take the good of your emotions,
Mhm.
the positive of your rational, logical self, because both can go to extremes. But we want to kind of get the both and make a marriage, a healthy marriage,
A healthy marriage.
a healthy union. And we can make decisions and choices that it might keep things the same, but it's not going to make it
Yeah.
worse.
Yeah.
And we actually want to make things better in our relationships, in our choices, in our decisions, in our careers, all those things that we need to be able to navigate in the moment, because as human beings we're going to react. And
Mhm.
usually when we react, it's kind of can be kind of negative. It can kind of be immediate, kind of be direct and blunt and harsh. But when we can slow down and take a breath,
Yeah. Take a breath,
just
as I just did.
take a breath. Yeah, and there's actually a skill called stop in DBT that allows us to see, analyze, see all perspectives, to look on the wider horizon, see the
Mhm.
bigger picture, and then to make a decision or choice that is much more strategic, a little
Mhm.
calculated. So then you can do what's not only in your best interest, this is where some of the interpersonal effectiveness skills, but also can also help the other person out too.
Mhm.
And it really makes for life to be a lot more enjoyable, and you can tap into other things such as gratitude and self-compassion, and it really can help to shape your thinking and to change some of those negative thinking patterns that really can get wired into not only our brain, but into our spirit, into our bodies too. You can feel that negative thinking. When people say, I didn't like their vibe, I didn't like their energy, that's a real thing, because that's how people think and that's what they believe.
Mhm. Yeah, and yeah, speaking to somebody, for me, like I can definitely, if the energy in the room is wrong, is off, then
Ooh.
there's a problem. Just side note, people, everybody that's watching, my IG has been acting weird, so if we end up getting cut off, we are gonna come right back. Um,
Okay.
just
Okay.
just FYI, and I'll call everybody back.
Yeah. Good.
But as you were talking, it also made me think of, so I also I've taught some of my clients bilateral stimulation.
Yeah.
And yeah, so I mean, essentially everybody bilateral stimulation is just an exercise that you can do to help kind of get yourself back into that middle brain, into a healthy marriage again. And so I could briefly, what it really is like you just take an object, any
Yeah.
object, um,
Yes. Yes.
put it in your right hand, and then cross your body and put it in your left hand, and kind of, you can't really see me, but let me see if I can make this. That just made it worse. But essentially, cross your body and pass the object back and forth, and this helps
Mm-hmm.
allow you to think a little bit more rational. And that's mostly because all when you're all worked up and you're in this emotional dysregulated place, all of your energy is going to one part of your brain, and you need to spread that energy out.
Yeah.
Um,
Shifted.
and so you're shifting the energy that's going on in your brain.
Yeah.
Um, and so sometimes I just randomly do this, especially when I'm feeling really anxious,
Yeah.
and just to calm myself down.
Yeah. Yeah. A big part of dialectical behavioral therapy is being able to ground yourself,
Hmm.
because the story is Marsha Linehan, who is the founder and creator of DBT, was walking in the forest. I'm trying to, my working memory, I'm trying to recall the story. But the gist of it is, she was walking, and she noticed that and she went for a walk because there was a problem that she was wrestling with. And she noticed that as she was walking, her eyes would kind of, shift back and
Hmm.
forth, kind of jerk back and forth. And she noticed that her eyes kept doing that. And as by the end of her walk, she was like, man, I just feel a lot more better.
Hmm.
She came to, an answer, the answers that she was looking for, she found. And she sat back and she reflected on, what was it about that walk that helped me feel. I was so worked up and I was so angry and I was so upset. And she figured out it was her eyes, the way her eyes were moving, that helped her kind of reshift what was going on in her brain and access, some deeper part of her brain, getting
Hmm.
into that subcortical part of your brain where a lot of our negative, traumatic, stressful, really, the deep, dark, quote unquote, stuff lives that hasn't been resolved. And
Right.
it allowed her that movement, the walking and the eye movement allowed her to come to some sort of resolution, some sort of felt that she could solve whatever it was that was bothering her. So really understanding that DBT is particularly effective with ADHD for that emotional dysregulation and the impulsivity, because when we impulsively do things and then we regret and we have remorse, DBT is like a stop. It's going to slow you down, bring you back to
Hmm.
what's going on in the present moment, the mindfulness, and really help you sort through to figure out a lot of more effective life problem solving, life solutions, life skills, problem solving, solution oriented um, um, approaches. So
Yeah.
I'm actually a fully certified dialectical behavioral therapist,
Okay.
and so um, I have the whole shebang with being able to do DBT. And I really do like DBT, especially for the mindfulness piece. And, a lot of things that I really hope that more um, school programs, mental health um, programs in school will teach DBT skills, because that emotional regulation, the interpersonal effectiveness skills, the mindfulness piece, and the stress tolerance skills, these are the things that we, as adults, we want and are expected to do in our workplaces.
We are expected to do them, and a lot of people can't do them. So,
Yes, yeah, yeah,
but no, but they should be teaching that in schools for sure, because that's, especially during time periods where your frontal lobe is still really underdeveloped. And then
yes,
with ADHD, there's still like some question around like the full development of your frontal lobe anyway, even as you're an adult, right? And so, when does the brain finish developing?
mhm,
26, 30? I don't know. I feel like I've read both.
yeah,
But that's old. Like
Yeah.
thinking about you're 30 years old and you're just saying like, oh, my brain is finally full developed. But then when you add ADHD to it and thinking about that there's still a little bit of undevelopment that's happening within your frontal lobe, and so that emotional regulation piece is so key. Being able to learning how to regulate your emotions is so key, and doing that mindfulness practice, and then also, I specifically work with women too, but just thinking, but this really is across the board. Like if you're having kids and and additional stressors that come with having children or having a family, or you're just moving from one person to two people to three people to four people, and then still people still working and still trying to make an income, and then, or you're at this age too where you're now caring for your parents as well. And so as you get older, all these additional stressors come on. And so being able to have a foundational skill set around how to regulate your own emotions and get you back centered is really, really important. And if you don't know how, like, this is your reminder, or like this is the message that you need to hear that says you need to make sure that you learn these foundational skills, and access some supports to teach you how to do some behavior therapy, to teach you how to do some dialectical therapy skills too, and to this is your wake up call.
Yes.
And does anybody have any questions? We have a few minutes left before I actually have to hop off. But does anybody have any questions? Anybody?
I see somebody says I have to hop off too, but it's
yes.
awesome.
Thank you for Sarah for joining.
Thank you.
Yes, the conversations have been really good. And so the replays we're editing, we're doing some editing right now on some of the replays. And so they'll be up, and I'll just set an alarm on my Instagram or something like that. And so that, because that's where I'm going to be announcing it, on LinkedIn, on Instagram, and on Facebook and all the other social medias, to let you know when the replays and stuff are going to be available. But every conversation has been really great.
Okay, so glad
and so
to it today.
Yes, I am so thankful for you, especially to be able to get some detailed information about these different types of therapies. This is so crucial for really anybody. But when it comes to the ADHDers, this is really crucial as well, since especially the DBT part, like emotional dysregulation, is one of the core challenges with ADHD. And so being rejected, and like it's very easy to go into emotional spiral. And it completely throw off the rest of your day and your ability to be productive. I mean, in the workplace, this could look like anything. Like this could look like you started your day and you had the right mindset, and then you walked into the organization, and then you opened up your email. And then you got your email from that one person. That you may not be the most fond of. And now your whole day, or like a couple hours later, you're thrown off. Or you had a conversation with your supervisor about your performance, and then now you're down this negative rabbit hole. And so it's important to be able to access these types of skills and these types of techniques at any given time during the day, so that you still have the ability to reach the goals that you're trying to reach.
Because being overwhelmed, some people can be quick to anger. Other people shut down. They freeze. They flop. And, so understanding that person that's sitting there not saying anything, and you think, oh, they're standoffish. They might have ADHD and just trying to process. And, it takes them a moment to get their thoughts and their words together. And they may not be, the person with ADHD that's more hyperactive and impulsive, maybe more inattentive. And I used to have a supervisor who used to say, "You're so quiet. I never know what you're thinking." So I would tell her, when I have something important to say, I'll say it.
Right.
Because I'm thinking. It takes me a minute to think. So, somebody asked what's the name of my company. Purple Pen Therapy.
Yes, please follow her, access her, see if she has some openings available, schedule an appointment.
I am. Immediate opening.
Yes, yes, and so she has all the certifications, and she can really help support you with your needs. And so this is an opportunity to reach out
Yeah,
to get some help, um,
thank
and to
you.
get some additional supports. There was one other thing that I wanted to say that I can't remember. Um, it's okay, but I want to thank you for coming on. I feel like we
Ooh,
probably need to have a part two, a part three, or something
yes,
like
we
that. It would be
do.
interesting. Also, I don't know how familiar you are with other types of therapy outside of CBT and DBT that we could
Yes,
potentially talk about. Um,
EMDR, brain spotting,
oh yeah,
acceptance and commitment therapy, brief
yeah.
solution
So
focus
So
therapy.
I need
So
to have you come back on. And so we
yeah,
need
I
to
need to
come
come
back
back
on.
on.
And so
Yeah,
we can come back on next month. Just everybody that's watching right
yes,
now, just pay attention to what I'm doing. So
yes,
and know that I'm going to be having some additional professionals, and she's going to come back on and talk about all the additional types of therapy and
yeah,
that you can access.
yes.
We are definitely going to do that, and I will send you a message after this
Okay,
to
all right.
make sure that happens. This is important. People, I think people sometimes shy away from accessing these types of supports because they don't really understand what it is.
Yeah, yeah,
Um, and so being able to kind of break it down for people where they don't
yeah.
have to read it, because that's the other thing, especially with ADHD. Like
Oh,
sometimes,
don't tell
like
me nothing going
going through
on.
the research rabbit hole or just trying to read all this information and process it is just not a thing.
Yeah. Yes,
And you're like not really reading it, you're just kind of glossing over it, you haven't processed anything. And so being able to have an actual conversation with somebody sometimes is just better.
yes,
And so I want to make sure that resource and that option is available for people.
yeah,
So with that being said, we do
yes.
have to end, and I hate to end,
All
but we do
right.
have to end. And I really look forward to our next conversation. And then also just a preview for everybody that tomorrow we have an organizer come in. And then next week, I believe our marriage and family therapist was
Oh,
that popped on. So we have a marriage and family therapist coming on next, I
cool.
think next week. We have an organizer coming on next week. I'm not an organizer, a nutritionist, I think, coming on next week, or a creative that has started a business. We got a lot going on. The schedule is going to be coming out tomorrow.
I'll be
So again,
following.
make sure that you are following me so you can know what is coming up next week, and
Yeah,
what time, so that you can tune in.
yeah,
And then I know over the course of next week, I'll be making some other announcements about different coaching options that are available, for that I'm going to be offering as well. And also, if you are a woman with ADHD, actually, right now I'm joining a group coaching that I'm going to be leading right now. And so, if you actually want to join the group coaching program, send me a DM and I'll send you the link.
okay. All right. Thank you so
um,
much.
Thank you so much. I'm going to send you a message after.
Okay, thank
Thank you,
you.
everybody. Have a great day or great night or wherever you are in the world.
All right. Thank you, everybody.
Bye.
Bye.